Good afternoon, and thank you for joining us for our final scheduled weekly COVID-19 press briefing. Today is Tuesday, March 29th, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here, and Mayor Johnson, I'll hand things over to you to get us started.
All right, well, good afternoon, everyone. I'd like to begin my remarks today with an update on our COVID-19 gating metrics for the week. We remain in the moderate transmission category for COVID-19 cases per 100,000, down to 22.9%, or I'm sorry, 22.9 cases per 100,000. Just a second here. Our percent positivity remains in the low transmission category, down to 1.7%. Our vaccine rates, 63.9% of City of Milwaukee adults, those are individuals, remember again, 16 years of age or older, are fully vaccinated, and 46.9% are fully vaccinated with the booster. We also remain in the low COVID-19 community level as well. Today, as was mentioned, marks our final weekly COVID-19 press briefing. As I just shared, cases have slowed down. We'll continue to monitor the trends and provide information to the public in other ways. Milwaukee's gating metrics will continue to be updated weekly on the city's COVID-19 dashboard, and information on testing, vaccine, and other news will continue to be updated at milwaukee.gov/coronavirus. The health department will continue to disperse and distribute press releases to the media weekly. And for those on social media, the Milwaukee Health Department will continue to post real-time updates and resources on its Facebook, Twitter, and Instagram pages. That's at Milwaukee Health. That's at MKE Health. As the situation warrants, we'll continue to have city-focused press events and briefings, either in person or virtually. I want to thank all the people who've been involved in these COVID briefings over the past 2 years. Lots of people have contributed their time and their talents, both on the screen as well as behind the scenes. Catherine, you yourself and the people over at Kane Communications have been steady. You've also been reliable, and we appreciate that. I also appreciate the collaborative spirit and the vital roles everyone has played in this forum. I include the news media in that. I include Commissioner Johnson and Ben Weston, Dr. Weston, that you'll hear from soon, the county executive, and so many other folks in our health fields and elsewhere that have helped in these efforts. You've all fulfilled your mission to provide the information to your viewers, listeners, and readers. It's been so important from a public health perspective, and we thank you for that. As you'll hear from Dr. Weston shortly, although our disease burden numbers remain currently low, we are aware and monitoring the presence of the BA.2 variant. We've seen this variant cause an increase in cases in Europe, and I want to remind residents that the same mitigation measures and tools like vaccine will continue to help to protect us from this variant, as they've done for the past variants. Remember the 3 W's to protect yourself and your family. Wear a mask, wash your hands, and watch your distance. If you haven't already received your vaccine or booster, schedule a time to do so at the Northwest, the South Side, or Menominee Valley testing and vaccination locations. Finally, I'd like to share that the Milwaukee Health Department's COVID response team is currently focused on targeted vaccine outreach, working directly in collaboration with organizations such as the Housing Authority and on in-home vaccination efforts. The public can continue to receive vaccine at the 3 health department community sites I just mentioned. Those again are the Northwest side, South side, as well as Menominee Valley sites, and at other mobile clinics as updated regularly at milwaukee.gov/COVIDvax. So thank you for now, and I'll turn it over at this time to Dr. Ben Weston, another great partner in delivering these press briefings. So Dr. Weston, the floor is yours.
Thank you, Mr. Mayor. I appreciate that. And good afternoon. First, to our numbers, we are currently seeing in Milwaukee County an average of 37 new cases per day and about 1 death every 2 days. And as said, today marks the last regularly scheduled COVID briefing for this time. And while this certainly does not mark the end of the pandemic, it does indicate a transition in strategy from regularly scheduled briefings to more targeted updates and messaging, adapting to the needs of the community and the changing situation of the pandemic. We now have had nearly 2 years, over 2 years of regular briefings. And I'm thankful to county and city leadership, including yourself, Mr. Mayor, for the dedication and investment that they've made and continue to make in mitigating the impact of the pandemic and working to enhance the health of all members of our community. Kane Communications, and particularly you, Catherine, have been incredibly valuable partners over the last 2 years in helping to develop and better target our messaging. And all of our health departments, but particularly the Milwaukee Health Department, under the expert leadership of Commissioner Johnson, who we'll hear from next, has been at the forefront of every effort, reaching into the most vulnerable communities, working endless hours to get information where it's most needed, tests to those who seek them, and vaccines to those in need, one person at a time. We've all worked together with an overarching goal that we all share, and that's to improve the health of every citizen and every visitor of our community. And that's what we plan to continue to do. The county and the city remain committed to increasing vaccination rates in our communities and providing timely updates to our residents so that individuals can make informed decisions about how to keep themselves and their loved ones safe and healthy. So we will continue to share key messaging, and we'll also continue to not only maintain, but improve upon our county COVID dashboard, which in the near future will have far more information on it about vaccine and booster administration. Now, shifting a bit, our trends in Wisconsin and Milwaukee County are largely flat at this point. In the county, we're lingering in the mid-30s for COVID cases per day. It's about twice what we saw in our low last summer. And similarly, our positivity rate is just over 2% and steady. It's flat. Again, about twice as high as we saw last summer. And our hospitalizations are around 50 hospitalized people with COVID each day, compared to less than 20 over the summer. Now, this is all likely influenced by that BA.2 variant, a more contagious, more transmissible variant of COVID that is on the rise in Wisconsin. We're now seeing over 40%, or about 40% of cases are from that BA.2 variant. Now, we don't know what the future of COVID will bring. No one does. Globally, cases remain higher than any other point in all of 2020 and 2021. Europe in particular has been a confusing picture of some countries with increasing cases, others with decreasing or steady cases, with the influence of that BA.2 variant. And as I mentioned, our own local trends are flattening rather than continuing to decline, with an uncertain future ahead of us. And meanwhile, we see what appears to be the beginning of an increase in disease burden in the northeastern part of our country, particularly watching a doubling of cases recently in New York City over the last couple of weeks. And we should understand that these trends may well shift to our own region very soon. So where does that leave us as a community? Well, right now, with relatively low cases, hospitalizations, and deaths, it leaves us in a position to take a breath, but at the same time, to take advantage of that reprieve to prepare. So first, to prepare as a community, to ensure that we have the capacity to rapidly increase access to testing, to vaccination, and to new therapeutics when the next increase in cases eventually occurs. And it's important to note that community preparation will only be hampered, particularly for vulnerable populations, as national level funding for the uninsured recedes. Now, second, to prepare as individuals. While mitigation measures are not as critical for everyone at this point in time with low disease burden, vaccination remains as important as ever. Now, getting vaccinated in the middle of a surge does quite little to protect you in the short term. But getting vaccinated and boosted right now, before another rise in cases comes, can help to ensure that you have the most protection possible with an uncertain future. Now, on that front, the FDA today authorized the second booster for those over the age of 50. Now, this is in part due to data out of Israel that shows a 78% decrease in death from COVID in older populations that had received 2 boosters as compared to just 1 booster. Now, as we see this operationalized in the coming weeks, it's important to remember that we will not boost our way, and certainly not double boost our way, out of the pandemic. With only 62% of our county having received any dose of vaccine, we still have significant strides to make to provide even basic levels of vaccine protection to many in our community, particularly among our vulnerable populations. So let us all share in that work with positive messaging and continuing to use facts to overcome misinformation. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. I want to start by thanking Catherine and Kane Communications for their work coordinating these media briefings every week and early in the pandemic every day. Their commitment to sharing reliable information with the public was instrumental to our ability to share information that's up to date and accurate. I've said many times before that fighting COVID-19 is an all hands on deck effort. So the collaboration between the county executive, mayor, Dr. Weston, Health Director Rausch, and the countless medical experts who have joined us cannot be understated. As a public health official, I want to thank you all for consistently prioritizing the health and safety of our community over the past 2 years. As the mayor and Dr. Weston stated, just because we're ending these weekly briefings does not mean COVID-19 is gone. The Milwaukee Health Department will continue our work to keep Milwaukeeans safe and protected. We have the tools to protect ourselves. We just need everyone's commitment to utilize them. If you experience symptoms or come in close contact with someone who has tested positive for COVID-19, mask up and get tested. Quickly implementing these mitigation measures can stop the spread of the virus and keep those around you safe. Most importantly, however, is making sure you are fully vaccinated and have received your booster dose when you're eligible. Both testing and vaccination remain free at the Northwest Health Center, Southside Health Center, and Menominee Valley sites. And as always, no appointment is required. As you may have heard, last week, the Health Resources and Services Administration, HRSA, announced the end of federal funding for COVID-19 uninsured program. This program provided testing, treatment, and vaccine administration reimbursement and was put in place early in the pandemic. Over the course of the last 2 years, it's paid more than $175 billion to over 50,000 providers. This change does not affect all COVID-19 providers in our city. Many sites receive state funding and will continue to offer free services. However, it may be difficult to identify which sites are free. We're currently working with our community partners to create a resource to identify which clinics are federally reimbursed and which receive funding from other sources. In the meantime, if you're going somewhere to get tested or vaccinated, we recommend calling ahead of time or making sure you ask if the test or vaccine or treatment are free. The COVID-19 services at the Milwaukee Health Department will continue to be free, and that is not going to change. Now is the time to get vaccinated. As funding sources are being reevaluated across the country, it's unclear how long these services will remain free. If you've been putting off getting your vaccine, make a plan today to get your vaccine and booster. Additionally, beginning April 25th, the Milwaukee Health Department COVID-19 sites at our Northwest Health Center and Southside Health Center will offer all childhood immunizations and blood lead level testing. Childhood immunization rates have decreased in the city of Milwaukee over the past 2 years due to the pandemic. As parents and caregivers, we make decisions every day to protect the health and safety of our children, from bundling them up during our Milwaukee winters to making sure there's healthy food on our tables. MHD is making it easy by turning our COVID-19 clinics into a one-stop shop to protect the youngest members of our community. Thank you again for the opportunity to share information with the public through these briefings. Please utilize our website at milwaukee.gov/coronavirus and follow the Milwaukee Health Department on Facebook, Twitter, and Instagram for up-to-date information. Our work isn't done, and our team is dedicated to protecting the health of Milwaukee and all who live, work, worship, visit, and play here. Thank you.
Thank you, Commissioner. I'll give it just a few minutes to see if we have any final questions. And then I see one coming in. I'll see if we have any other COVID specific questions. So we'll just give it a few minutes. Otherwise, I will go ahead and ask your question, Emily. All right, I'm seeing a few coming through here. Emily's question, Emily McTavish with CBS 58. With Summerfest lineup out, how confident should concert goers be attending the event? Also, any headliners that the panel is looking forward to?
It's a good question. I was just looking at that today. I think given what our data is right now, I mean, granted, Summerfest is in a couple of months. If our data remains flat, if our cases remain flat, I would be confident going to Summerfest and feeling safe. I think the caveat with Summerfest is it's outdoors, which certainly works in Summerfest's best interest. It's also during the summer. We know our cases went down at the beginning of the summer, last summer, because again, we are going outside. So I would feel fairly confident, but I think the message is, again, COVID's not gone, and we need to be diligent and conscientious of where our case rates, what's going to happen in the coming weeks and months.
Yeah, I would agree. We've always talked about layers of protection, and Summerfest is a place where you can get a few layers of protection. And the most valuable one there probably is that it's largely outdoors. And so you have that added layer of protection. You can also self-distance as much as you want, depending on how crowded it is. So I would certainly agree. If case numbers stay low, which hopefully they do going into the summer, it seems like a pretty safe activity to partake in, obviously considering your own vulnerability and medical issues.
Because we have the experts here to answer the tough question, I can answer just the fun part of it in terms of what sort of acts out there that I'm excited about. I'm excited about Lil Wayne. I'm excited about Justin Bieber, Avril Lavigne. Of course, because we got kids and little kids, it makes it a little difficult. But I'm excited about them. If we get the chance, I'm looking forward to seeing some.
Excellent. Next question comes from Eric Gunn with the Wisconsin Examiner. He's wondering, as probably a follow-up question to Commissioner Johnson, what are the prospects for more reinstating the free treatment or services, maybe in relation to HRSA?
That's a good question. I think a lot of this is dependent on Congress and what they determine should be appropriated to the continued COVID response. I can say that from the City of Milwaukee Health Department, we will continue to offer free services as we are not funded and we're not billing HRSA for anything.
Our next question comes from Bill Miston with Fox 6. He says, what are the biggest concerns or worries as cases remain flat?
I can answer this too, and I'll hand it over to Dr. Wesson. I think we just don't know. I mean, that has sort of been the message all along. This is a novel virus. We learn more every day and every week. We don't know if there's going to be another variant or another surge. So again, just being diligent. And if you do know someone who has COVID or if you're exposed, again, we know what we need to do. We need to be vaccinated. We need to mask if we are exposed, and be careful.
Agree completely. As we're seeing a flattening of cases and a flattening of positivity and a flattening of hospitalizations, and even I didn't mention it, but a flattening of deaths. We still have one death every other day or so. I think the uncertainty is concerning. Uncertainty because we see such variation around the world of what's going on with COVID right now. We know it's not over because it's a dynamic process through the world, but I think we have the tools in place, if we can use them effectively, to keep cases relatively low, and most importantly, to keep severe disease, hospitalizations, and deaths fairly low. And that starts with vaccine. So reach out to folks around you, talk to them about your experiences, and try to get others vaccinated.
All right. The next question is from Sharon Powell about if we will be returning these briefings at some point. And I think the message is we're just continuing to evolve our communications as the pandemic evolves. As Dr. Weston, Mayor Johnson, and Commissioner Johnson stated, the city and county are remaining committed to sharing out COVID-19 communications. We're just evolving what that will look like. So continue to look for daily, weekly messages related to COVID-19, and we'll see what's needed moving forward. But nothing is scheduled at this point. Our next question, it comes from Sean Kirkby with Wisconsin Health News for Commissioner Johnson. Do you have any data on how many people in Milwaukee benefited from HRSA programs for uninsured individuals?
It's a really good question. We're working through the data right now. As of right now, all we see is the dollar amount, and it's being reported by hospital systems that were billing, or any pharmacies, whoever was billing. So it's a dollar amount for the city of Milwaukee, which doesn't tell us anything about the number of people. So again, we're working through that data. So hopefully we'll have some better answers in the coming weeks.
And the second portion of that question is, what do you see as the future of the Milwaukee Health Department testing and vaccination sites? How long do you expect them to remain open?
It's a really good question. We intend to keep them open at a minimum through the end of June. And then I think we'll reevaluate where we are at that point. And we also anticipate a need to potentially reopen in the fall for boosters, or if there at any point, if there's a surge, we intend to be prepared to reopen as needed.
And the final question in the chat that I'm seeing at this time is from Eric Gunn with the Wisconsin Examiner, asking, is it important to recognize the flattening of cases at the current level is different from further decreasing?
Yeah, I think it is important to recognize that. Now, it's important to also recognize that our levels are low. Our case numbers, our positivity, and our deaths are all quite low. Our hospitalizations aren't quite as low as we'd like. And to your point, the trends aren't quite as persistent as we'd like. I had hoped that we'd get a little bit lower, and we may still. We'll continue to watch. But when we have flat trends like this, it's always, as it's been throughout the pandemic, important to look outside of our bubble, outside of the county, outside of the state, and see what else is going on. And when we see what's going on in the northeastern part of the country, when we see what's going on in much of Europe, when we see what's going on in parts of Asia, it should make us take pause and wonder if that'll come here, and look to history, just 2 years of history, and see that it almost always does come here. We're not insulated from what goes on in the rest of the country or what goes on in the rest of the world. But as I mentioned, that's the more pessimistic view. I think the optimistic view is that we do have the tools in place to do better than we have in the past if an increase in cases comes. Those tools include therapeutics, mitigation measures, and most importantly, vaccination.
We've got a follow-up question from Sean Kirkby for the commissioner. Are you able to share the dollar amount for uninsured programs for the city of Milwaukee?
I certainly can share it. I don't have it off the top of my head, so I can email it as soon as I get into my email and look for it.
Thank you, Commissioner. So we will follow up with you, Sean. And at this time, we have another question coming through from Bill Miston with Fox 6. Are there areas the city intends to prioritize for public health, namely in the matter of gun violence, which has been deemed a public health crisis?
Absolutely. So the City of Milwaukee Health Department is currently going through a strategic planning process. There's been a tremendous amount of change in the City of Milwaukee Health Department over the last couple of years, not to mention a pandemic that we're coming out of, looking at recovery and what are our priorities. I can say that violence and the Office of Violence Prevention is a priority. Lead poisoning of children, specifically related to paint and soil, and our maternal and child health statistics, so infant mortality and maternal morbidity and mortality. And those three priority areas rise to the top of my head, but in addition, mental health. So again, we're working through a strategic planning process that will be shared with the community in late spring, early summer. But absolutely, violence is at the top of the list.
Thank you, Commissioner. Those are all of the questions I'm seeing. So that does conclude our final scheduled weekly COVID-19 briefing. Thank you, Mayor Johnson. Thank you, Dr. Weston and Commissioner Johnson, for your service, for your kind words. Thank you for continuing to provide weekly updates to our residents. Your service has been invaluable. And thank you, media, for consistently joining us and reaching out and asking important, tough questions so that we're getting out the information to our constituents. So we appreciate everyone on this call. This is our last briefing for now. Take care.
Thanks, everybody.
Thank you.
Thank you.